Now starting. All attendees are in listen-only mode.
Good afternoon, everyone. Today is June 19th. I'm Donna Will, Professional Development Coordinator for the Developmental Disabilities Administration. We welcome you to the Friday series of updates. We have several presenters today. Bernie Simons, the Deputy Secretary for DDA. Also with us is Rhonda Workman, Director of Federal Programs. Valerie Roddy, Director of Fiscal and Operations. Bianca Renwick, Deputy Director for the Central Maryland Regional Office, and Kimberly Gescheidel, Director of the Eastern Shore Regional Office. So before we begin, I'd like to go over a few things about the webinar. All participants are in listen-only mode. There is one option for listening to the webinar, and that's by computer. There's a handout for this webinar, and you can find it in the handout section on the panel on your right. We will be recording the webinar, and it will be posted on a YouTube link on the DDA website. Questions can be typed in the question box, and we will get to those at the end of the presentation. So now I'd like to introduce Deputy Secretary Simons. Good afternoon.
Hi, good afternoon. I want to welcome everybody to this webinar that we're doing. Again, today being Juneteenth, I think that it's an important day. I think everybody recognizes this, and again, we need to think about moving forward with all of the issues that we've got going on between COVID and other unrest in the country. So we'll do obviously some opening remarks that you'll see on my first slide for the agenda. Our updates, we're going to have Rhonda Workman talk about the transition in youth. We did send out some information this week, and as Donna just said, we're going to have a presentation on what we look like, at least in the central region and in the east region, and how we think we are moving forward with facilitating that. I just want to point out that today is our 13th webcast that we've done, and again, I'm really happy that people have been giving us positive feedback about these webinars. So as we go to slide 3, obviously we know that we're in stage 2 of where we are, and that the governor has broadened the criteria for opening. Obviously at 5 o'clock today, we'll see more openings as in the executive order. We also know that we've broadened the number of testing sites, and there are now more than 150 major testing sites, and you'll see on that slide, and obviously you get a copy of these, that you can click on that and then go to the locations that are very, very convenient. I think as we continue and to have the reopening, and as you see in our numbers as we get down to a couple of more slides from now, that there are different percentages throughout the different regions that we have, with West being the lowest and the South region being the highest. I did see an article today that talked about the highest counties in each state, and obviously it was one of our counties in the South region that was in that article. It talked about all of the counties in each state with the highest number of positive people testing for COVID-19. I also want to make sure that everybody's aware, and this is on our website also, that the COVID-19 federal provider relief payments are available. That came out on June 9th to all of our providers. And that there's a link on our website. The providers work directly with the federal government. It is not money that comes through the state and then to the provider, and that there is $15 billion in additional relief for eligible Medicaid and CHIP providers. And so as we move forward with that, I would encourage providers to basically apply for that. HHS, as I said, Health and Human Services, is overseeing this directly. And again, that's on our DDA website so that you don't have to go searching for it. On the next slide, you'll see on slide 4, because we pay prospectively and we pay through our PCIS2, and we know that there's a process. We have to load all of the payments by the service into PCIS2. From there, it has to go through budget and management. From there, it goes through the comptroller, who then issues payments directly into accounts. So we are in the process of moving forward with the first quarter payments since today's June 19th. And our expectation is it'll get through the system and you will be paid into your account on or before July 6th. Now, many people say, you're loading the money from last year's rates into this year's rates, and that's correct, because as you can see in the third bullet, a final decision on rates will be made early in the fiscal year for the rates and the payments, and they'll be adjusted accordingly, and that's from the Department of Budget and Management. DDA does not have the authority to look at any type of rate increases or whatever. As many of you know, have been around for many years, and at least I've been here 6 years, and we've seen rate increases that have come through the governor's budget, et cetera. And then and it's varied in some years from percentage to percentage. And so again, we'll see. We know that there is a significant problem with the amount of revenue shortfall, with a lot of businesses closed, et cetera. And so the revenue and sales tax and many other things have not been available to the state. Plus, there's been an additional cost to the state, with setting up testing sites, et cetera. And so, again, I know that several of our families and providers keep asking about the 21 budget, but it is out of my purview as the Deputy Secretary. So, again, we should know something as this is a quote basically from the budget and management folks. And so let's go to regional updates. And so as of June 18th, yesterday, the South region has had 209 people who have been confirmed positive, 58 negative, 2 are still pending, and we have had 14 people participants in our waiver pass away. In the East region, we have had 29 positive cases, 28 negative, so that's almost a 50-50 split, 1 pending, and we have had no deaths. In the Central region, we've had 139 confirmed positives, 196 negatives, 8 are pending, and we had 13 people pass away. And in the West region, we've had 19 confirmed positive, 52 negative, 47 pending, and 2 deaths. Now, the question you may recall from last week is, why is the West region showing so many pending results? And it's because some of the providers out there have built into their reopening plan that everybody would be tested. So that's why our numbers start to look as they do. So staff, in the South region, we have 148 positive, and we've had 4 people pass away, 25 positive in the West, 50 positive in the East, and 149 positive in the Central region, with 1 person who's passed away. On the next slide, we basically have stayed just about the same. with the 2%, about 380 people, and you'll see we've got our total number of people who are in our waiver with 17,764 that are in our services, and about 2% of those individuals have tested positive. And you can see on the right-hand side of this slide that there is showing the actual numbers and the actual increases that there have been within the past short period of time. And so again, you'll see that, as I said earlier, when we talk about the regions and reopening plans that each provider should be developing, you can see that obviously there are different factors that would come in, especially if you look at the two lines on the bottom that are the East and West, that are in a much different place than obviously the South region and the Central region. And so as you look in the next slide, 7, you'll see that we have gone up a little bit, and we have had, as of this date, June 12th, we have had an increase of 2 participants who passed away. If you look at my numbers on the bottom here, you'll see that it says 380 participants reported having tested, and there have been 28 deaths. I can tell you that the 28 deaths, unfortunately, is now 29, because when we did this slide a couple of days ago, we've had one individual pass away since then. So we do keep data as live as we can. We monitor this. I want to thank the families and individuals for keeping us updated on the status of their loved ones. And so the pie chart on the right talks about 28, which is really now 29. And again, because that's within the last couple of days, and this slide was done a few days before that. And again, it's about 7% of the total amount of people who have tested positive with the 380. And so we continue to share information and resources. We continue to want to engage with everybody so that we have the most current data that's available, so that we can share that on these Friday webinars. We will continue to help individuals thrive. We will continue to work and coordinate with families, with providers, with people who are self-directing, with people who are on micro boards. And again, I want to thank all of you for your dedication in working with the DDA and everybody that we provide supports to. We need to be collaborative, work with each other, and continue to get through this COVID-19. I mean, the good news is you can see that the numbers and all of the indicators daily seem to be coming down. The number of hospital beds, the number of confirmed cases, et cetera. And so it's obviously everybody's doing a good job, the right thing, social distancing, wearing masks, et cetera. So with that, I want to turn this over to Rhonda Workman, who will be talking about transition in youth. So thank you.
Thank you, Bernie. As Bernie mentioned, we did share some communications this week related to transitioning youth. So we wanted to kind of share a little bit more background and some of our numbers. Next slide, please. So transitioning youth are individuals with a developmental disability who qualify under DDA for a special reserved category associated with the DDA waiting list to initiate our funded services. Transitioning youth are also a reserved category under the DDA waiver program. So when an individual meets the criteria as a transitioning youth, then they're generally eligible to apply for enrollment in one of our DDA Medicaid waiver programs, meaning the Community Supports Waiver or the Community Pathways Waiver. The DDA receives referrals for potential transitioning youth from a variety of different sources. Potential transitioning youth include youth transitioning out of the local school system, public agencies, private schools, the autism waiver, and also the foster care system. Next slide, please. Transitioning youth and families are encouraged to explore service delivery models and service providers prior to transitioning out. Some explore during the last few years of their educational services and do this via transitioning youth fairs that are conducted with the local school system. Beginning in January of the last year of the youth, the transitioning youth eligible apply to the DDA for enrollment in our programs and receive assistance with our waiver application process from our coordinators of community services. Transitioning youth must meet the DDA waiver specific technical, medical, and financial eligibility criteria to include providing supporting documentation such as the applicant's bank statements, any income they have, trust, or other items that are requested from the Eligibility Determination Division. Prior to the COVID-19 state of emergency, these actions to enroll in and initiate DDA-funded services, such as submitting that waiver application and exploring providers, typically took place prior to the youth transitioning date, and the selections of providers was made in January of the transition year or sooner based on the service models offered from the providers. Due to the COVID-19 state of emergency, many of the transitioning youth and families have not been able to complete the DDA waiver enrollment application process or been able to identify the DDA service providers that they would like to work with to support their goals. Next slide, please. This slide is an overview of the status of transitioning youth based on a report that we pulled from LTSS Maryland, which contains the DDA waiver application packet. Transitioning youth have a one-year period after they exit the school system to apply and enroll in a DDA waiver. For transitioning youth 2020, meaning transitioning youth that completed school last year in June of 2019, the data reflects that there were 738 youth offered the opportunity to apply, for which 572 had been enrolled as of yesterday. There are 50 waiver application packets pending the final financial eligibility determination and 116 individuals pending. Pending means that they may be in various stages of the waiver application process. It's important to note that not all transitioning youth apply and enter DDA services. Some pursue post-secondary education goals. Some receive services from other supports like the Division of Rehabilitation Services, and some decide not to enter services at all. For the TY 2021, there are 703 transitioning youth. This number can increase as more people are referred to the DDA. At this time, 149 have been enrolled. There are 440 in various stages of the waiver application process as noted under pending. As mentioned on our previous slide, the waiver application process and selection of providers generally begins in January. As you know, mid-March was the beginning of the state of emergency, which has greatly impacted the completion of the waiver application process. In addition, providers have suspended tours during this time due to health and safety concerns, and that has also impacted the selection of providers. As we shared, transitioning youth have a year to complete this process, and the DDA and the coordinators of community services will continue to provide support and assistance to make sure all youth and families have the opportunity and the information they need in order to make a decision about enrollment in the waiver program. In addition, we know that several transitioning youth and families have selected providers and made decisions based on provider service models and service hours prior to the state of emergency. These offers and service models may not be available at this time or may have been redesigned based on our current state. Families and youth may want to reconsider those options and the delivery of those service models and have the opportunity to make changes. Next slide, please. This week, we provided additional information and guidance specific to autism waiver youth transitioning out. So on Tuesday, June 16th, we shared a memo titled Extending Transition Timeframe for Autism Waiver Participants Exiting the School System and/or Aging Out During the COVID-19 Pandemic. This memo was a joint memo that included our Deputy Secretary, Bernie Simons, Marlena Hutchinson, the Acting Director of Office of Long-Term Services and Support, which is within the Medicaid office of our department, and Marcella Frankowski, the Assistant State Superintendent from the Division of Special Education Early Intervention Services of the Maryland State Department of Education. In our correspondence and information that we've shared and also posted on the DDA website, we included guidance for our coordinators of community services and the autism waiver service coordinators noted in the Autism Waiver Transitioning Youth 2021 guidance. In addition, we created a customer-friendly fact sheet referred to as At a Glance that is also available to help share information with youth and families. Next slide, please. A provision of the autism waiver, Appendix K, includes the ability to continue funding for services and receive services covered by the autism waiver program for participants who are 22 years of age or older during the COVID-19 state of emergency. This means that autism waiver participants who would otherwise be disenrolled from the autism waiver on June 30th can remain in the autism waiver and continue to receive services funded by the autism waiver, even though they have completed or concluded their entitled educational services. You may recall, if you were able to join us last week, Christy from MSDE, the Maryland State Department of Education, was sharing information related to this. Next slide, please. The guidance that we have shared includes a process for both the autism waiver service coordinators and the DDA coordinators of community services to support eligible autism waiver transition youth and their families in making an informed decision as to whether to disenroll from the autism waiver or to continue and transition at a later date. We have already begun to receive decisions from youth and families this week after issuing the guidance on Tuesday, and we are taking action to support the continued enrollment in the autism waiver based on those families' choices. We'll continue to support individuals and families and monitor transitioning youth in all types of transitions as we go forward. At this time, I'd like to turn it over to Bianca to share some information about the Central Region reopening discussions. Next slide, please.
Good afternoon, everyone. The Central Maryland Regional Office leadership met with some of the providers in the region, and I would like to share with you some of the items that we discussed. Next slide, please. So as you see, these are the framework considerations. Central to that is safety, and we discussed capacity, equity, data, collaboration, and innovation. Next slide, please. Again, when we look at equity, we're looking at the purpose, our outcome. We're looking at the people that we serve, how to be flexible, who has the power, what barriers we are encountering, and how we can collaborate together to get what we need to get done. Next slide, please. So safety. As we begin to move our communities forward and reopening, we would like that safety be considered at the forefront of all of the decisions that we make and the actions that we take. And our providers understand that DDA Maryland is committed to the health and safety of people with disabilities, our providers, and our community at large. Next slide, please. So these are some of the things that we discussed during consideration. What are the orders of the Governor of Maryland to slow the spread of COVID-19? What are your agency's local jurisdiction orders related to slowing the spread of COVID-19? How is your agency implementing the recommendations of the Maryland Department of Health and CDC liaison, Dr. Feder, particularly as it relates to visitors, community engagement, social distancing, the use of PPE, and screening tools. What is the individual's health and safety need of people you support, and how will that factor into your agency's decision moving forward? Does your agency have enough PPE to control the spread of COVID-19? And if you don't, how will you obtain the necessary PPE to safely move forward, considering the possibility of a resurgence? And has each agency updated its emergency safety plan to address COVID-19 and a possible resurgence? Next slide, please. So we talk about collaboration a lot. As a person-driven system, DDA encourages agencies, individuals, and their families, and their coordinator of community services to come together as a team to discuss what moving forward look like for each individual person. DDA is committed to collaborating with our stakeholders to ensure that you have up-to-date safety information through our collaboration with Dr. Fetter, further Appendix K guideline, and supporting each other as we navigate the path forward. Next slide, please. So these are some of the things to consider as you look at your collaboration. Who will be the key partners in your agency when you're making reopening decisions? Who will you involve people, families in decision moving forward? How will you collaborate with individual teams to determine the health and safety support needs of each person you support, keeping in mind Dr. Fetter's recommendations and local jurisdiction orders? How can you collaborate with a partner agency as you determine the best practices moving forward? And how will you collaborate with DDA as you move forward? Next slide, please. Data. As you know, this is a very data-driven system right now, and in this public health emergency, data has been the driver for most of our local jurisdictions. As agencies begin to look at how to reopen, it will be important to have the right data to make the right decisions. DDA is also committed to utilizing data and facts to drive our decisions as it relates to COVID-19 guidance and the recommendations. Next slide. So what data do we have? And so things to consider as you're looking at data. What data have you collected as an agency? What data do you need as an agency? What data are our partners using to make decisions? What does the Maryland Department of Health and DDA have that would be helpful to make the decision as you move forward? What local jurisdiction data is relevant to your reopening strategy? And how will you use data to guide our process? And how we will use data in the event of a resurgence. Next slide. Okay, next slide, please. Okay. One of the things we talked about also was capacity. As agencies begin to look at reopening, it will be important to look at capacity as it relates to the health and safety considerations, but also workforce, financial, and technology. The DDA is committed to supporting agencies build their capacity through provisions of the Appendix K, but also throughout continued collaboration with Dr. Fetter, the CDC liaison with the Maryland Department of Health. Next slide. Okay, for capacity, these are the considerations that we spoke about. What is your agency's workforce capacity right now? What are the fiscal implications of reopening now? What capacity does your agency have to reopen all programs versus a rolling reopening? What capacity does your agency have to look at an alternative schedules? What capacity do you have to implement more remote support? What is the capacity of the individuals and families you're supporting to return safely? What is your agency's ability to respond to a resurgence? What is your agency's capacity to secure adequate PPEs? And how can we rely on community resources and supports to help meet the needs of the people that we support? Next slide. Innovation. As you know, a lot of people have been doing remote monitoring and using technology. So again, as we look at a path forward, innovation has been the key to ensuring that we can meet the challenges of the day-to-day and provide the health and safety supports people need to live a good life. in the community and with the families. We are committed to supporting creative and innovative ideas that are in alignment with our mission and values. Next slide, please. And when you're considering innovation, some of the considerations that were discussed: what do families and individuals need to be safe, but also engage in community and build relationships? How can we increase our use of technology to support individuals, families, and agencies? How do we ensure greater flexibility around accessing supports and reducing burdens to accessing these supports? What does case management look like as we move forward? And what ideas are you willing to share with your local partners? So again, we can incorporate collaboration here. What ideas can you share with DDA so we understand what it is you're doing and what you need from us? How can we work together to identify and connect with community resources to enhance the other supports individuals receive in their lives? Next slide. So as we had this meeting, next steps we determined would be to incorporate the feedback that we received. We're going to put it together and send it out for review. And of course, as we're able to, we will add the information on the DDA website as a resource. So I'm going to turn it over to Kim Gashidel so she can share Eastern Region's meeting.
Thank you, Bianca. Good afternoon and greetings from the beautiful Eastern Shore. So I'm happy to tell you a little bit about the work group meeting that we had, and we're calling it Provider Considerations for Reopening Work Group. And for our group, I'm really happy to report that we had representation from all of our providers in our region. And additionally, we had representative from the Maryland Developmental Disabilities Council and from the Maryland Association of Community Service Providers. So we were very excited to have them as well. In this process, the format was a little bit challenging, but our providers were able to use their microphones if they had them, or were able to use the chat box. So we made the best of the situation. I think we're all going to get better at this as we go along. So as Deputy Secretary Simons had noted in his previous webinar on June 5th, in our discussion, we focused on three considerations. We focused on the individual level considerations, the provider level considerations, and system level considerations. And we did that through a filter of health and safety, capacity, and lessons learned about new and creative ways of helping people update their goals and achieve their desired outcomes. One of the things that seemed to make sense, we pulled together a Google Drive where we can put information that our providers are willing to share about their own plans, and we've had several folks who've developed some pretty well articulated plans regarding their plans to reopen. Additionally, other resources that are available from other states or from our colleagues in other regions. So it's a very dynamic place to include information, and the feedback is that folks will find this very useful, and also that they will intend to contribute to this Google Drive as we continue on this journey of looking at how our individual providers plan to reopen. And it's important to note that our providers are at very different points in their transition plans for their agencies. Some, as I mentioned, have pretty well articulated plans. They're looking at some soft openings. Other folks are really starting to look at this point on, okay, what is it going to take to get us there? And so this is really helpful timing, I think, for all of our providers in working through this. Next slide, please. So some of the key points that emerged. All of our providers are making efforts to be person-centered. They're reaching out to families in many ways, in surveying their opinions, offering them supports on site where that seems to be necessary, and in some cases even making visits to provide support, guidance, recruit information, etc. And so folks are seeing that as very key in how they're going about developing their particular plans for their agency. Many, and I would actually say here, pretty much all of our providers are making really excellent use of remote access. But there are big issues that were identified, and particularly with some of our more rural areas that don't have reliable connectivity. And in terms of being able to get that staff training out there on site with folks when they needed it. And so folks are really looking at what kind of resources can be brought to bear. Some providers have been able to continue to accept applications. And actually, we have providers who have even begun services for new individuals with the appropriate testing, PPE, et cetera. Some were able to do interviewing through Zoom camera, and I do believe in one case a provider had reported that they were actually able to make a very controlled, socially distanced application meeting to really cover the issues and make sure that there was going to be a good fit in consideration of the individual for services. Some individuals, through the supports from their providers, were able to remain in essential jobs with staff support. And there was a person who was even able to start a brand new job with accommodations to support a job coach. So I really can't say enough about the creativity and the committed, focused nature of the supports and services that our providers are bringing to bear in this really, really challenging time. And in looking at summarizing where we were and where we're going, providers reported that they found this to be a very helpful meeting. They'd like time to review the information that's on the Google Drive, and they would like the opportunity also to look at the kind of information that they heard from their colleagues, et cetera. And so we are planning to go ahead and meet again in about 2 weeks. And I'm sorry, Donna, I forgot to ask you to advance the slide. So we are really looking forward to seeing where this takes us, and continually really pleased and surprised at the creativity and the ingenuity of our providers in addressing the reopening challenges. And at this point, I believe I will be opening for questions for the panel overall.
Yes, thank you, Kim. And so we've got some questions in the question box. The first one, Kim, I think you can address. It is, would it be possible to share some agency reopening plans and/or Google Drive link in Eastern Shore Regional Office for read-only access?
Oh, I think so. Now I say that very, and I'll ask Tori and make sure that this can be done, but I believe it can be. She's our guru who set this up for us. But we're more than willing to share, because we've certainly received some information from colleagues from other parts of the state on what they're doing, and certainly the information that was shared during the webinar on June 5th really gave a lot of excellent points. So we're more than happy to do that. So thank you for asking, and I would say just send us an email and we can add you.
Great, thank you. Bianca, there was a question that came in when you were talking about considerations, and the question is, what is an example of a fiscal implications for reopening?
Okay. I'm sorry. What is an example of the fiscal implementation for openings? So an example would be the staffing. I know some people have been having issues with staffing, and we know, and of course you have to pay them, and we're trying to, and some people may need more support than they did before. So again, you have to put in your request so that you make sure you're funded appropriately for someone who may not have needed one-to-one support prior to the COVID pandemic, but now may need more support. So that would be an example of fiscal consideration.
Great. Kim, did you have anything that you wanted to add to that?
You know, I think there are a myriad of things, and I think that's one of the things that our providers are going to be discovering, particularly as it relates to, say, how you're going to manage transportation. You're not going to be able to transport the same number of folks that you used to in the same way. So what is that going to cost? What are you going to need for ongoing costs for the sanitation, for PPE, for all of those kinds of things? You know, how are you going to restructure how your services are being done? How are you going to make sure that folks have the kinds of ability to continue to do remote access? What's that going to look like? Does there need to be additional software? Does there need to be additional connectivity? There are many things, I think, that have a cost associated with them in moving forward.
Great, thank you. We do have a few questions that came in related to first quarter payments. First question was, what about first quarter payments for grants? Valerie, would you like to help us with some of these?
Yes, I'm on. So I'm not sure what they mean. I know that the regional offices have been working with on some of the that we do provide, and I'm not sure what other questions they may be trying to can sent out in a manner.
Okay, a couple more. When will we receive invoices to sign and return?
I will have to check on that. They really should be printed probably certainly no later than early next week. But I will have to check because I'm not sure.
Okay. And then we have some questions related to the new cost detail form and in terms of when the rates would be updated or issued.
The cost detail form will be going out early next week.
Great, thank you. And one other one, it says clarification, the first quarter payment will be paid on FY20 rates, but an adjustment may be made based on rates approved by the comptroller. Is there a chance rates will be reduced?
Well, first off, it will be the governor and the Board of Public Works if there are any changes that are made to the rates. I really can't speculate on whether or not rates will be reduced. I really don't know. So that's why we are waiting the final decisions to see if there will be any adjustments made.
It's just an update. Rhonda just lost her mic, but she's going to be dialing back in. Let's see. Give her a second. Hopefully she'll be back. Might be able to ask a few questions. Someone asks, thank you for this information. Are providers still going to be able to provide services virtually when EVV starts?
Yes. Yes, there is a way for providers to bill for those services or personal support services while using the EVV system. Generally, what happens is that you will have to do a manual entry.
Okay. There are TYs that have been approved for the waiver and chosen a provider. Submission of SFP is on hold due to lack of the cost detail. When will this be available?
As I mentioned, I think just maybe a few questions back, it will be available next week.
Donna, can you hear me?
Yes, I can.
Yes.
Hear you. I'm glad you were able to get.
Yeah, I'm sorry, my call dropped.
I read some of the questions at the bottom of the list, so
Okay, I will go back to some of the ones at the top. Thank you, and again, everybody, I apologize. There was a question about the autism waiver eligible youth. It says that they can only receive services from approved autism waiver providers. Is this correct? If the autism waiver youth is still enrolled in the autism waiver, if that's their choice, then yes, they would only be receiving services from autism waiver enrolled providers. There's another question related to fiscal. It says some providers are under the impression that the additional COVID funding for residential due to day program closures is ending on June 30th. Please clarify if it ends on June 30th or remains in effect until Appendix K is lifted.
It does not end. I will repeat, does not end on June 30th. Appendix K is in place until March of 2021.
Great, thank you, Valerie. Another question related to the transitioning youth is, there's an opportunity for a person in the autism waiver to delay accessing TY services. Will others not enrolled in the autism waiver also have an opportunity to delay entering transitioning services while providers reopen and determine what their service models will be? So this is a great question, and the answer is yes. As we shared in our presentation, transitioning youth have a whole year to complete that waiver application process and identify service providers, so they can continue to explore those options and find out about the new models that are provided. Just going to go through a couple other ones. There was a question that says, last week it was said that Appendix K is in effect until February 28, 2021, not March. So to clarify, the autism waiver, Appendix K, has a different effective and end date than the DDA, Appendix K. The autism waiver, Appendix K, is in effect and will end on February 28th, 2021. The DDA, Appendix K, will go through March 12th of 2021. So they have differing time frames. There's a question about what is the deadline for attendance forms, May, etc.
So I was assuming that maybe they're asking about putting the attendance in for the month of May. It's always 30 days after the month has ended. So the deadline would be June 30th to make sure that all the attendance for the month of May is inputted into PCIS2.
Thank you, Valerie. There's a question related to the federal funds that Bernie had mentioned, and it says, what does the new HHS relief funding cover / address? Bernie, would you like to answer that one?
No, you can do it.
Great, thank you. So from my understanding, related to these relief funds, it has been shared, I think, with Bernie and other information sources. HHS has provided federal relief for Medicare providers, and the money has been distributed. And they also wanted to provide some relief for Medicaid providers. And in recent requests from HHS, the Medicaid office has provided data related to claims and expenditures for Medicaid providers. Based on that, HHS is providing funding per Medicaid provider if they have not already received a percentage based on their Medicare services, and that arrangement and amount will be shared with the provider specifically. The state does not have any role in that, nor will we be informed of that. Bernie had shared that there is information on our website related to this relief and additional actions that you can take. It is also posted on our department's Medicaid site for all Medicaid providers to be able to view and respond to. So looking through some additional questions. Someone is asking to repeat the information about non-autism waiver TYs having extra time. The answer is yes. Individuals that are transitioning youth have a 1-year period in order to make that decision. And so even if you're not an autism waiver participant and you want to transition in September or October, that is an option for you. We would just need to know the date that you would like to start services. And we have historically had individuals transition in and start services during the summer months. However, some people wait to start services in the fall, and others may wait until the end of the year before they make a decision. There's a question that says, part of our TY process is that the prospective candidate visit our program, but due to COVID-19, how should we proceed? Do not want to accept based solely on reports. Kim, I believe you shared that some agencies are looking and interviewing people. Can you share a little bit more about that?
Yes, my understanding is that they were able to do interviews through Zoom and ask questions, answer questions, etc. And I think that this is only limited by whatever your creativity is in terms of how you might show what your work options or training options might be, etc. But I think folks found it to be a functional process and that folks felt like they got the information that they needed in that way. They weren't going to just go from paper, but they were really able to do it using Zoom or Skype or whatever the platform was that they were most comfortable with.
Thank you, Kim.
You're welcome.
There's a question about the difference between community pathways waiver and the community supports waiver. And so just as background information, the DDA administers 3 Medicaid home and community-based waiver programs on behalf of Medicaid. It includes the Family Supports Waiver, which supports children up to the age of 21, the Community Supports Waiver, which supports individuals of all ages and includes our Meaningful Day services and support services, and the Community Pathways Waiver, which is considered waiver, meaning that it includes all our support services, our Meaningful Day and employment services, in addition to residential support. Transitioning youth would be applying to either the Community Supports Waiver or the Community Pathways Waiver due to their age requirements and also for their service needs of Meaningful Day services. So those are the differences with the program. Just looking at some of the questions here. There's a question that says there are transitioning youth that have been approved for the waiver and chosen a provider. Submission of the service funding plan is on hold due to the lack of the cost detail. When will this be available?
Oh, I think we already answered that question, Rhonda, and I said it would be available early next week.
Thank you, Valerie. Another question. With EVV, meaning the electronic visit verification, being online by January 21, has there been any thought about how to implement this with virtual services?
Yes, there is a way to do that. So we have several service providers who are participating in a pilot in LTSS. And some of those providers are also doing personal supports. So we do have some of those participants using the EVV system now. And given what we've been experiencing the last 3 months, quite obviously, we had to make some adjustments. So what, since the EVV system is managed by the Medicaid office, they have given us some instructions that for what we might call, remote services for personal supports can be billed through EVV, but it will have to be done through through a manual entry. So for those folks who have to do it, there is a mechanism. There's something that's being used now. So as we start to roll out EVV, there is already a pathway to address this issue.
Thank you, Valerie. There's a question about, can people use already approved CAMP funds for other services since camps aren't opening, and such as respite? So related to this question, I think it depends on what service or program you're talking about and support. I believe communication has gone out for our low intensity support services, where people may have identified that they wanted to use their funding for camp. And yes, we want you to be able to make other selections based on your needs and circumstances. And so we would encourage you to work with your coordinator of community services or the list provider that is supporting you related to letting them know the change in your selection of services. In terms of DDA waiver services, the funding cannot, yes.
Oh, I'm sorry. Before you leave the list program, I would like to mention that any changes, any requests to change how you will use the award needs to be done by June 30th.
Thank you, Valerie. So given that, it's important that if you are going to use your money differently, that you do look into that and reach out to the list providers to let them know that, and they are more than happy to assist you with that. If you have funding associated with respite for camp in the DDA waiver program, you can use your authorized services for other respite options, because camp is a component of our respite services, but you can't automatically transition that fund to another service unless you are self-directing services. Under the self-directed service delivery model, the participant, as the employer of record and as the provisions in Appendix K, has the ability to do a budget modification and move those funds. People in the transitional service delivery system have the opportunity to work with their CCSs or use the Appendix K's flexibility to identify additional needs and request services that way. Then there's another question that came in related to, since participants cannot fall out of the DDA waiver during the pandemic, can they increase their DDA funding even though they are not in a waiver according to PCIS and EVVS? So as we shared, during the state of emergencies, participants should not be disenrolled from any waiver program. And Marlena Hutchinson shared with us last week, this also relates to the state's maintenance of efforts. If an individual is not showing up in PCIS2 or the electronic verification of services, please alert the DDA so that we can look into and resolve. Participants that remain enrolled in the waiver program, even though they no longer meet that eligibility requirements, can continue to receive the waiver services that they have. I hope that helps to answer that question. We will take these questions that and put them with our FAQs. Bernie, would you like to close us out for today?
Yes, thank you. I hope that this was helpful. We've had a majority of the people, the attendees, stay with us. We obviously always lose a few people. Again, as we continue to move forward, we'll do another webinar next week. And if you would, if there are other topics besides what we've already covered that you are interested in relating to the COVID-19 crisis, we'd be happy to entertain those topics. With that, I want to wish everybody a good weekend and happy Father's Day. Thank you and bye-bye.